Patient safety is your first priority, but it's just as important to take care of yourself so you can continue to take care of others. Masks and respirators do different jobs. It's important to understand the difference. Masks often fit loosely over the face, leaving gaps between the mask and the wearer. Masks help prevent large particles expelled by the wearer from reaching the patient. They also help protect the sterile surgical field from contamination of exhaled particles. In addition, fluid-resistant surgical masks help reduce wearer exposure to blood and body fluids. NIOSH-approved N95 respirators are designed to fit tightly to the face and create a seal between the face and the respirator, and are intended to help reduce the wearer's exposure to certain airborne particles, including those generated by electrocautery, laser surgery, and other powered medical instruments. For this reason, respirators require fit testing using an OSHA-approved protocol prior to use. In addition, some N95 particulate respirators have also been cleared for use as surgical masks. To show how respirators seal to help provide respiratory protection to the wearer where surgical masks may not, we'll look at a demonstration of an individual wearing a surgical mask, as well as a disposable particulate respirator that's also cleared for use as a surgical mask. This instrument measures the concentration of particles in the air and the concentration of particles inside the mask or respirator. The bars on the instrument indicate the leakage of the mask or respirator being worn. When there is leakage, there is a possibility that airborne particles are inhaled. A high reading means the mask or respirator is leaking a lot. A low reading means the mask or respirator is leaking less. A well-fitting respirator should have a reading less than 1% leakage. Let's compare the individual wearing a surgical mask and the same individual wearing a particulate respirator that's also cleared as a surgical mask. Particles have been generated around the wearer for the demonstration. Here you can see the instrument shows the surgical mask has a high rate of leakage, demonstrating how the mask is not designed to provide the wearer the protection of a properly fit particulate respirator. Now, you can see the worker is wearing a properly fit particulate respirator, and the instrument shows a very low leakage reading. Take your respiratory protection personally. Help protect yourself, help protect your patients. Choose respiratory protection when you need it. To learn more about 3M particulate respirators that are cleared for use as surgical masks, go to 3m.com/healthcaremasks.